IVF is a confusing enough process, and to make it even more confusing, we throw around acronyms that make everyone scratch their heads. IUI, IVF, ICSI, PICSI, IMSI, PGT, PGTA, PGTM, all of these things make our patients sort of wide-eyed and a little bit puzzled. So let's actually break some of these abbreviations down. And interestingly, we'll find that the most common depiction of IVF is actually not of IVF itself. Let's start with IUI, intrauterine insemination. This has nothing to do with IVF or its remnants. It is literally waiting for ovulation and just prior to ovulation doing a small pap smear-like procedure to insert some sperm into the uterus. Timing is crucial because the sperm actually needs to be waiting for the egg as it ovulates. So doing the IUI procedure after ovulation is too late. IUI is used for very minor sperm issues, for functional issues, for timing. It can be used also in same-sex couples and a few other minor indications. Generally not as powerful as IVF or its derivatives, and probably IUI on its own is no better than intercourse. Okay, what about IVF? In vitro fertilization. Literally fertilization in the glass as a reflection of how IVF started on petri dishes. It is still the most common form of assisted reproduction technologies, and it is a really good form of it. It is where we actually take the egg and the surrounding cells and put it with a droplet of concentrated semen. So what happens is that when we do the egg collection, not only do we get the egg, but we get its halo or cloud of supporting cells. These cells have been instrumental in the egg's development, and they're even more instrumental in fertilization. And what we do is that as we put the droplet of concentrated semen, which contains thousands and thousands and thousands of sperm, we leave the egg and the semen alone overnight. And what happens is that this cloud of cells that surround the eggs help the egg choose which sperm it lets into the egg. This insemination process is much more natural, and it's better really for people with normal sperm than anything we possess from a technological perspective. And certainly we have seen, at least in our hands, that people who don't have sperm issues do well with IVF in terms of their embryo quality. What about ICSI? ICSI, intracytoplasmic sperm injection. It has many derivatives like PICSI or IMSI. These are all forms of ICSI. And ICSI is what people most commonly associate with IVF, even though it's actually not IVF. So this is where a scientist takes an egg, strips it of all the cells that surround it, and then look down a microscope, finds what they think is a good sperm, and physically inject it into the egg. There is a degree of trauma associated with the eggs, so in poorer quality eggs, they don't do well with ICSI. In people who have poor sperm qualities or poor sperm parameters like motility, concentration, and morphology, ICSI can be a very powerful tool, but ICSI is not necessarily needed for everybody. ICSI has several derivatives like PICSI and IMSI, which is probably beyond the scope of this video, but they all are forms of a scientist selecting out the sperm, stripping the egg of its outside surrounding cells, and injecting the sperm into the egg.